welcome. My name is Brenna Tonelli. I'm with Arizona State University's Edson College of Nursing and Health Innovation. And so we are here today to share some information with you about Edson College programs that we offer at ASU, and then also some information about my path to ASU. So we have a couple members from ASU with us today, so I'm going to give everyone a chance to introduce themselves. Kathy, would you like to introduce yourself next?
Sure, thanks. Hi, everybody. I'm Kathy Silberman, Program Manager for Community College Engagement and Academic Alliances at ASU, and I'll come in at the end with some info about my path to ASU.
And then Deanna.
Yeah, hi everyone. My name is Deanna Castellanos, and I work with Brenna on the recruitment and admission team for the Edson College. I'm our designated transfer lead, so I work with a lot of our concurrent enrollment program students who are interested in that particular pathway. And I'm here today to help answer any questions that you have throughout the session in the chat. So I'll be assisting you all there.
And then it looks like we have it set up so you can put questions either in the chat or the Q&A. So Deanna will help monitor both of those. So if you have questions that come up and you don't want to lose track of those questions, you know, we'll address that as we go. But we'll go ahead and get started. So again, thanks for being here. All right, so the first thing we wanted to talk about with the Edson College of Nursing and Health Innovation, the first thing we want you to know about is where we're located. And so that kind of helps inform some of our next slides. So we'll start there. So we are located at several campuses and locations that ASU has. If you're familiar with the ASU model, we are kind of one university in many places. And so we have campuses kind of in the Metro Phoenix area, and then we have locations scattered kind of across the country. So where we're located, where the Edson College specifically is located, is at the downtown Phoenix campus. We're also at the West Valley campus. We're at the Polytechnic campus. And then we're also at a couple other spots. So before I move on to those, I just want to highlight really quick that the downtown Phoenix, the West Valley campus, and the Polytechnic campus are all in the Metro Phoenix area. So downtown is, you know, right in downtown. The Polytechnic campus is about 30 to 40 minutes east of there in the East Valley of Phoenix. And then the West Valley campus is about 20 to 30 minutes northwest of the Phoenix campus. So all are easily accessible to each other. We also have programs that are available at our Lake Havasu location. So if you're familiar with Lake Havasu City, that is up in the kind of northwest corner of our state, kind of on the California-Arizona border. So we have programs that we offer there. And then we also have programs that are available through ASU Online. So lots of different options for your students to access our programs. And when we talk about the programs that are available to students and kind of what's the best fit for them, a lot of times our conversations focus on, you know, what's best for the students. So if they're weighing between, do I go to Lake Havasu or do I go to downtown Phoenix? We might have conversations with them about the cost associated with each campus or each location. For example, Havasu enjoys kind of a lower tuition rate, which is attractive to a lot of students. Whereas, you know, sometimes people like the commuting better for certain campuses, or maybe they're planning to move to the East Valley. So that's, you know, Polytechnic might be better to them. So we try to talk students through their options, but just to know for you all that we're located at those areas. All right, and so the next thing we'll talk about is the degree programs that we offer. So we want to make sure you're aware that not only are we a nursing college, but we also have a lot of other programs in health and healthcare. You know, there's lots of options at ASU, but these are the ones that we specifically offer to our students. Next to each of these programs, you'll see a little icon demonstrating what campus we're located at for each of those programs. And we're going to go over the next few slides talking a little bit kind of high level about each of these programs so you know what they are. And then we'll dive a little bit more into nursing, because I know that's a really popular option for students who are interested in our college. And then if you have questions, like we said, you can always pop those in the chat. All right, so let's start with our health program. So this is what we would, you know, lovingly refer to kind of as our non-nursing programs, but they're really our baccalaureate health programs. So we'll start with community health. So community health is a 4-year bachelor's degree. There is a My Path to ASU available for this major. This program is available kind of where almost all of the places that we're located, except for Polytechnic. So we're at downtown Phoenix, West Valley, Lake Havasu, and online. And this major is really designed to prepare students to to work in community health, right? And so creating healthy, sustainable communities with an emphasis on working with at-risk populations. So when we break that down, it could be, a student who works for a nonprofit that's focused on community health and wellness. Maybe it's community health education or outreach or programming. It could be someone who works in, when we say at risk, that there's a lot of populations who are at risk. So it could be in rural areas. It could also be in urban areas. I mentioned students can work in nonprofits. There's also hospitals that have community health outreach arms. So at least in Arizona, like specifically in rural areas, we see a lot of that. And then there's also, jobs with the state or government jobs that also focus on community health and well-being too. So you can see on this slide some of the featured courses in this program. They're really focused on preparing people to lead community health programs. So needs assessment, program development, program assessment, changing behaviors in community members, that sort of thing. And then as far as career paths, if students are interested in this program and they ask, what can I do with this major? Again, a lot of individuals will find themselves at, in various different sectors, but usually as health educators, health program managers, health program evaluators, nonprofit healthcare workers, that sort of thing. All right, so the next one we'll talk about is healthcare compliance and regulations. This one is a really awesome offering that we have that a lot of times students, when you guys all enjoy working with, our community college students, when we see students first come out of high school into college, they're not really sure what compliance and regulations means. But as they get a little older and they have more exposure maybe to the healthcare system or different business sectors through their jobs, they learn a little bit more about what this means. And so compliance and regulations is offered at the downtown Phoenix campus and also through ASU Online. And it really looks at the legal, ethical guidelines that kind of dictate how healthcare systems run. So nearly every healthcare organization, it has someone who's responsible for compliance and following state, local, and federal regulations. And so it's really, these are kind of the healthcare workers that don't necessarily work on the patient-facing side, but more of the business side, to not only protect patients and the people who work at healthcare agencies, but also to protect the interests of the organization itself. So this is a really great degree program for students who are business-minded, but like healthcare. And there's a lot of really great job opportunities here too. So some of the courses students might be taking in this program, they're going to learn about medical billing. They're going to learn about healthcare licensure. So, some compliance workers are making sure that the nurses that work in their hospital actually have the correct licensure to work there, same with their physicians and so on and so forth. They'll learn about fraud investigation. So looking at insurance fraud and billing fraud, those types of things. And again, making sure that everything is up to standard and following regulatory guidelines. Some example career paths. Again, you're going to see that word compliance come up a lot, but compliance managers, HIPAA, you probably are all familiar with HIPAA, or health privacy officers, billing and auditing managers, those types of positions. And then we are really excited because we were the first certified undergraduate program that was accredited by the Compliance Certification Board. So students who graduate from our program, they'll get a letter from us letting them know that they can share with the Compliance Certification Board, and then they can follow their guidelines to seek certification in this area. All right, the next one we'll talk about is healthcare coordination. So this major is preparing students to coordinate healthcare, as the major implies. And what that means is really like helping to navigate resources and the healthcare system to maximize patient outcomes. So if you have ever been in the hospital or have had a loved one in the hospital, you may, and it was like kind of a serious diagnosis. It's not diagnosis. It's usually not just like you get discharged and it's like, good luck, that's not really what they do at hospitals. Usually there's a care plan that individuals have to follow. And so a lot of times there's a care coordinator, and sometimes that individual is a nurse, and sometimes it's someone who's not a nurse. And so this major is not preparing students for nurse licensure, but to be a care coordinator. And so these individuals might work with patients and families to help them navigate their care plan, understand their insurance, understand what needs that they have and what resources are available for them so that, again, they can maximize their health outcomes. And so this program is available at our downtown Phoenix campus at our West Valley campus and then also through ASU online. Students who graduate from this program, they see a lot of different titles that mean care coordinator, but they might see things like care navigator, benefits coordinator, patient care coordinator. Those are some common titles. You might see individuals in management roles who oversee a coordination team. Students might end up working for health insurance companies because they're also very interested in ensuring and patients follow their healthcare plan so that they're well, but also to minimize costs for the insurance company. So they provide resources for that as well. So that's another program we have. The next one is health entrepreneurship and innovation. So like compliance and regulations that we talked about a couple slides back, this program is also kind of the business side of healthcare, but a very different lens than compliance and regulation. So in compliance and regulations, they're following kind of rules that have been set and making sure everybody's in compliance with those rules. Health entrepreneurship and innovation is really looking at what are some of the problems that we're facing in healthcare. And if you turn on the news, certainly it doesn't take long to hear about some of those issues. Or if you talk to someone who works in healthcare, you probably hear about the struggles that they sometimes are facing. And so our entrepreneurs and innovators in healthcare are working to identify those problems and then working to find solutions, but also to implement those solutions. So a lot of times we say things like, oh, someone should really do this to solve that problem. But then it's about what are the steps that need to be taken to actually implement those changes and solve the problem. So in this major, students are going to learn about facilitating innovation. They're going to learn about different types of technology to help advance innovation. They're going to get some management and leadership courses. There's some finance courses built in there as well. But a lot of this program focuses on the theory of like change and implementation of new ideas. Students who graduate from this program will find themselves in jobs such as healthcare administrators, project managers. They might be entrepreneurs and own their own business. They might be an intrapreneur and someone who is really looking at innovation from within an organization. We actually have hospitals locally, and you might have them in your areas too, who hire individuals who are focused on innovating process. And so these students would be uniquely prepared to help implement solutions. All right, and the last one we'll talk about before we get to nursing is integrative health. So this program is available at our downtown Phoenix campus, West Valley, and then also online. And integrative health is this really lovely blend of like research and then healthcare. So, and not just almost like how you would learn about research and history and theory within like a liberal arts major, but really paired within a health college. And so integrative health looks at evidence-based complementary care. So everything is rooted in evidence, but it really looks at that holistic care. So looking at the whole person, mind, body, spirit, how can we improve someone's wellness in other ways that aren't just traditional medicine? And not to say that traditional medicine is not good, because it is. There's certainly the place for that. This is, again, complementary. So not a replacement, but complementary. Within this major, one thing that's really exciting is that we have a pre-health or a pre-med track available. So if you have students who are interested in going on to graduate health programs like medical school or chiropractic or naturopathic, this could be a really great option where students can make sure they get all the prerequisites for those programs built into their major, but then their other courses are focused on this like integrative wellness, essentially. So looking at the legal and ethical issues of integrative health, the historical and cultural foundations of integrative health, mind, body, and energy therapies that are rooted in evidence. So this is really kind of a great, interesting major for students who have like a passion for holistic wellness. And so example career paths, we have a few listed here. The ones with the asterisks are ones that definitely require further education. But again, this program does have those science courses and math courses built in to prepare students for further education. All right, so I know we went over those quickly. I want to be mindful of everybody's time. Again, if you have questions on any of those, please feel free to plug those into the chat. I do want to emphasize that all of those programs are available through My Path to ASU. So if a student was interested in looking at and signing up for My Path to ASU, they could find those majors in the search, which Kathy will review with everybody once we're done with our portion, and they can sign up for those. So that's good for students to know too. All right, let's dive into nursing. So many of you are probably familiar with this, but I just want to start kind of with a very basic for those of you who might not work with nursing students regularly. We let students know there's 2 steps really to becoming a registered nurse. Step 2 actually has a second step built into it, but step 1 is completing that academic degree in nursing. So that could be a bachelor's degree in nursing, which is what ASU offers. It could be a master's degree in nursing, which we offer as well, but it can also be an associate's degree in nursing that you may offer at your school as well. And so as long as that nursing program is approved by the State Board of Nursing and has all of its appropriate accreditations, then once they finish that degree program, then they'll take a test called the NCLEX. And the NCLEX, once they pass that, is what they use to get their licensure to work as a nurse. And they'll get licensed in the state in which they want to practice. Some students get a multi-state license that allows them to practice in kind of a compact state system, but students would usually get licensed in the state where they want to work. So we'd like to talk about the benefits of a BSN or higher. We know that a lot of students get their associate's degree in nursing and become nurses, and then we have partnership programs to help them get to their BSN or higher. And so just sharing really quickly that the BSN is the preferred entry-level degree for the nursing profession. So even if students start with the associate's degree in nursing, eventually getting that BSN is kind of the gold standard. And so that increases their job opportunities. Some hospital systems look specifically for BSN prepared nurses because of their own accreditation. So that's a good kind of standard for students to meet. Again, the employment outcomes are better for students with a BSN or higher, so there's higher pay potential. It's also a stepping stone to advanced degree. So if you're ever talking to a student who is looking at your nursing program or other nursing programs and they're like, I want to be, a pediatric nurse practitioner, or I want to, just be a nurse practitioner in general and not sure their specialty, the BSN is part of that progression to go on to that graduate degree to become a nurse practitioner. There's also proof that there's improved patient outcomes. There's been a lot of studies by the AACN and other nursing organizations that show that patients who have a BSN or higher prepared nurse are more likely to have better outcomes when they're ill. So lower mortality rates, and then there's also lower failure to rescue rates. So all around, the BSN or higher is just good for patients and nurses as well. So we have several nursing pathways at ASU. And so we're going to go over each of these pretty briefly because we know we don't have a ton of time together. But I do want everyone to know that even after this presentation, if you have questions or you're interested in learning more, we can always share additional details with you or set up an individual meeting with you. So the first one we're going to talk about is the concurrent enrollment program. That is a combination of the associate degree in nursing and a BSN. And that one does have a My Path to ASU associated with it. We also have the RN to BSN program, which is again an associate's degree and a BSN program. That also is My Path to ASU has that integration there. We also have a traditional BSN, an accelerated BSN, and a master's entry into nursing practice. And so those last 3 programs aren't affiliated with My Path to ASU, and those are true pre-licensure programs that we teach at ASU. So I want to start with the concurrent enrollment program, and some of you may be familiar with this already, and some of you may have not heard of it at all. But the concurrent enrollment program is offered through ASU Online. It's essentially a collaboration between community colleges and ASU, and it allows students to complete their associate's degree in nursing at the community college while simultaneously taking courses online through ASU to finish up their BSN. So all of the coursework at the community college follows the community college model, which is usually in-person coursework for an associate's degree in nursing. And then all of that ASU coursework is 100% online. So they don't have to come to Arizona for any portion of their program unless they want to come meet us. So this really allows nurses who are preparing to, or students who are preparing to become nurses, so future nurses, to advance their education without slowing their progression to their RN. And so again, they can work on both side by side. The eligibility criteria really vary by community college. So we have some pretty formal partnerships within the state of Arizona. And so if you're at an Arizona community college, you're probably aware if we have a more formal agreement with you. And then we also allow students from out of state, so out of Arizona, to enroll in this program as well, whether there's a formal partnership with their community college or not. If they meet certain criteria, then we'll allow them to co-enroll. You'll see this small note at the bottom of this slide. Because of state regulations about schools of nursing operating in their states, we are not accepting students from Tennessee, Rhode Island, or Washington. So if you are, if you're at the community college in one of those states, unfortunately, your students would not be eligible for the concurrent enrollment program if they're pursuing their program there. But all other states we're fully open to. So the next one is the RN to BSN program. The RN to BSN is also 100% online. The RN to BSN program is essentially the concurrent enrollment program, but instead of completing the programs together, doing the ADN and the BSN together, they do one and then the other. So they're not stacking them, they're doing it in a more of a linear progression. So in this model, students complete their associate's degree at the community college, they get their RN license, and then they enroll in the BSN at ASU. And those are, again, all online classes. There's no requirement to come to Arizona. As far as eligibility for this program, we're looking for a current unencumbered RN license. And then we're looking for a minimum 2.5 GPA in English 101, English 102, and college math. Same rules apply about state restrictions, so we aren't able to take students from Tennessee, Rhode Island, or Washington. So this is an option for students as well. I did want to plug one thing that I don't have on my slides. Yeah, I don't have it on here, but I did want to share. If you are from an out-of-state community college, or we don't have a formal agreement with you within the state of Arizona, then what we'll do is we'll review students for the concurrent enrollment program. Kind of similarly to RN to BSN, we're looking for completion of English 101, English 102, and college math with a 3.0 or higher. So there's a little bit of a higher GPA requirement simply because students are going to be taking two programs together, and we want to make sure that they're doing well enough to handle that, that extra course load. So we do review students through that process. If we have a formal agreement, we might have some other requirements built in based off of that agreement. And I also wanted to mention too, if you're in California, many of your students might be taking statistics instead of college math. If they have an IGETC or a CSU GE, that will come into ASU and fulfill their math requirement. But they will need a statistics class still. So it would be recommended they take stats with you all. And then because our stats requires a math course. So we work with students really closely on that. So if students have questions, they can always just come to us. I'm getting into the nitty gritty. Sorry about that. Okay. So for CEP and RN to BSN, I mentioned they're pretty much the same program, right? And so this is really the breakdown of the courses that are required for this program. These are the ASU courses specifically. So students will take up to 75 associate degree nursing courses or credits will transfer to ASU from the community college. So if you're familiar with ASU transfer, you probably know that usually ASU caps transfer credits at 64 hours. For this program, the RN to BSN and CEP will take up to 75 credits from the community college. And then students will have 36 credits in nursing. So those ones will come from here, right? And that's these 9 courses here. And then they will need 9 upper division credits to get to the 128 credits for graduation that are required. So these 9 upper division credits, sometimes they take those at ASU and they need to take some general studies or things like that. sometimes they already have a bachelor's degree. Maybe they're a returning student. And so we can take some additional upper division transfer credits from a four-year institution. So every student scenario looks a little different, but this is kind of the core classes we have students taking with us. All right. The other thing that I want to say before we move on to the pre-licensure programs at ASU, if you are at a community college that would be interested in learning more about the concurrent enrollment program for your students, myself and our director for the RN to BSN and CEP programs, Dr. Natalie Haywood, we often meet with community colleges to talk through what that model could look like for their students. And so if you're interested in that, I'll have my contact information at the end, and you can just reach out to me and we can set up a meeting to talk through that. Okay, so let's dive into the pre-licensure programs at ASU. So these would be the programs that maybe students take some of the prereqs at the community college and then they want to transfer and do the clinical nursing program at ASU. So we have 3 pre-licensure programs: that traditional BSN, which results in a BSN. We have an accelerated BSN, which results in the BSN. And then we have a master's entry into nursing, which results in a master's, not a bachelor's degree. All of them prepare students to take the NCLEX and get licensed. So the traditional BSN is available at the downtown Phoenix campus, the Polytechnic campus, and the West Valley campus. So 3 campuses that are in the Metro Phoenix area. Transfer students can complete their prerequisites at the community college, or they can transfer to ASU and finish up any that they're missing. We can help them identify courses that would count for our prerequisites, so we can help them through that process. When a transfer student applies to our nursing major, they're going to initially be admitted to community health. So you might be remembering that community health was the first major that we talked about. So community health shares the same first 2 years as the traditional BSN major. And so that includes the whole prereq package for nursing advancement, essentially, into the traditional BSN. So they'll initially be admitted as community health, and then they'll finish up any prerequisites that they need. And then once they are eligible to apply for the clinical program, that traditional BSN clinical program, then we'll have them apply through what we call the competitive application process. And so if they're selected through that process, then we'll change their major to nursing and we'll get them enrolled in their classes. So I don't expect you all to remember all of these things. We're happy to work with students directly, but just a few things to know. This program has 17 prerequisites that include a lot of general studies like English and math and statistics. We don't guarantee placement in this program. It is a competitive selection process, but we do encourage any interested student who is eligible to apply. And we place students by their GPA and a TEAS exam score. So if you're not familiar with the TEAS exam, that's the test of essential academic skills. And so students can take that through ASU or find a location where they live to take it. And then we have 3 cohorts that start this program per year. So we have a spring cohort, a summer cohort, and a fall cohort. And each one, the size varies kind of from time to time, but we have each of those options available. All right, and so the next one that we'll spotlight is the accelerated BSN. So this program is offered at the downtown Phoenix campus, and then it's also available at our Lake Havasu location. If we open that up to other campuses, we'll announce that for students, but currently those are the 2 locations that it's available at. So the accelerated BSN we have an advancement pathway for both post-baccalaureate students and first-degree students. So I know a lot of the students at community colleges are first-degree seeking students, but you might have some who already have a bachelor's degree as well. So either type of student is eligible to apply for this program, but their requirements might vary a little bit. So transfer students can complete prerequisites at their community college or at ASU. And like I mentioned before, if you are working with a student and they're having trouble finding a prerequisite that's equivalent at their community college, we can certainly help them. So very similarly to the last slide, when a student applies for the nursing major, if they're a transfer student, they're going to be admitted to that community health major. And then once they meet eligibility for advancement, and we'll help them through that process, they'll apply through that competitive process. If they're selected, they'll be changed over to the nursing major. So the competitive application process for this program varies based off, again, that admit type, whether postdoc or first degree. So depending on their degree status, they'll have either 10 prereqs or 17 prereqs. If they're a first degree student, they have 17 prereqs, and they match the prereqs that the traditional students do. If they're a postdoc, they'll have 10 prerequisites. Again, placement's not guaranteed, and we place students by advancement score. And again, if a student is interested and eligible, even though we say placement's not guaranteed, we absolutely encourage them to apply. We have 2 advancement cycles per year for this program. So the spring cohort starts at the downtown Phoenix campus, and then the fall cohort starts at Lake Havasu. And this one I really want to spotlight. The Lake Havasu location has significantly less expensive tuition than our downtown Phoenix campus. So if you have students who would be moving to Arizona and are not sure where they would be moving to Arizona, if they are willing to go to Lake Havasu, you know, there's tuition benefits there for them as far as the less expensive cost, but also that pathway historically has been less competitive. And so again, we would encourage students to explore that option. And then the last one is this master's entry. And again, we won't spend a lot of time here, but just for awareness, if you have a student that you're working with who already has a bachelor's degree and they're not, you know, sure where they're going to land, we do have what we call a MEPIN. Sometimes they're called MECIN programs, but it's just a master's entry to nursing. So this one has 8 prerequisites. It is competitive selection, but it's a holistic review. So instead of just looking at test scores and GPA, we look at kind of the whole student and their application, their personal statement, all of that good stuff. And then we take 2 cohorts a year, spring and summer, and those are currently only at the downtown Phoenix campus. All right, so like I said, I don't really expect you to remember all of that information on the nursing program. I just wanted to spotlight some quick facts so you knew what we had. If you have a student who's interested in nursing at ASU, we have some links that are designed to support them. So the first one is this nursing information sessions link. So if they go to this link, it will take them to a page with some pre-recorded videos and also the option to sign up for a live information session. So we usually offer those a few times a month. We have one that's dedicated for first degree students. We have one that's dedicated second degree students. And then we also have one that's dedicated to students who are interested in the concurrent enrollment program. So lots of options for them to sign up for. If your student doesn't want to watch a video or attend an info session, we also have a nursing information packet that we keep updated. And then we have a separate application guide for those interested in that MEPIN program. So, so feel free to send these links share these links with your students. I can also share out this presentation with all of our attendees afterwards if you want to have those links on hand. So really quickly, kind of stepping away from just majors, I wanted to just spotlight some of the undergrad opportunities we have in our college that are really exciting for students. So the first one is the internship component. Our internships have really grown over the past few years, and those experiences our students are engaging with. So our nursing students get a lot of experience, you know, in the hospitals as part of their clinical rotations, but for our health students, our baccalaureate health students, they also get a lot of opportunities to engage in career development through our internship program. So these are just a few of the internship locations that our students have done things at. If you're local to Arizona, some of them might seem more familiar than if you're non-local. But all students in our health programs can opt to participate in an internship, and we even have options open for online students too. If your students are interested in study abroad, we have options for them there. And then we also do research and service learning. So again, we're not just a nursing college. Our faculty are interested in lots of aspects of health, including healthy aging and resiliency, stress coping, sleep, all sorts of things. So if your student's interested in engaging in research or service learning for credit, we have those opportunities for them too. All right. So I think that's the Edson College portion. So we'll still be here to answer any questions that you have, but I am going to pass things over to Kathy, and she's going to talk about my path to ASU.
Hi, everybody. Thanks, Brenna. Yeah, everybody, think of your good questions while I'm telling you a little bit about my path to ASU, and then we'll open it up for Q&A right when I'm done. So I just wanted to share my path to ASU. I know some of you use it all the time already, and some of you might be brand new to my path to ASU. So I'll just take a few minutes to give you the overview on how to sign up and, of course, the benefits. So students do save time and money overall when they're using my path to ASU to transfer to ASU, because first of all, they're starting with you at the community college and they're maximizing their transfer credit that will apply at ASU. They follow a customized course by course and term by term pathway, which minimizes the potential loss of credit overall, that they're not, showing up or graduating rather with like 100, 30, 140 credits, and a bunch that they don't need because they have it all laid out for them. They're tracking, they can track their progress all along the way using a tool called My Transfer Guide, which I will show you in just a moment. And they receive personalized communications about their major. So they would receive a welcome from the dean at Edson or whatever major. I know some of you might advise or be counselors for other majors as well. So they would hear from the academic unit that houses their major and be welcomed as a My Path to ASU prospective student, knowing that they're going to finish up with you and then come on over to us when they're ready. So they would also receive invitations to online and in-person events that could be helpful to them in planning their transfer. And they get guaranteed admission into the major of their choice when all of the pathway requirements are satisfied. So it's a nice centralized resource for them to use along with their check sheets and packets and different resources that they are using with you to get their associate's degree. And so to search My Path to ASU majors, because Brenda just showed you a handful of different majors, and so to look back and forth at some of those, compare them and everything, and then also to sign up for a pathway, you can go to asu.edu/mypathtoasu. And when you go there, Brenda, go ahead and click one more time if you would, please. I'm surprising you with this. I know I didn't warn you about the little extra things. And if you can click one more. All right, so there's a little close-up of the two buttons. So on the right-hand side, I love this one because as a former academic advisor, I really didn't like to sign up for accounts just to be able to access the information for students. And so I love just being able to search the majors and compare and look up requirements quickly. And then if a student's ready to sign up, they would click on the Get Started with My Path to ASU side. And so when you're exploring, just looking up requirements, comparing majors and all of that, getting familiar with My Path to ASU, this is what it looks like. This is just a real quick video. All right, we're ready to go on to the next one. I know it always wants to start over. You have to tell it a few times. Go ahead and there we go. Thank you. You got through the brick wall. So students are going to put in some information about what major they want to apply to. And then, Brenda, if you could go back I think just one slide. Sorry about that. Okay, let's go forward then. Sorry. Okay. All right, so yeah, they're going to go ahead and put where they're attending community college. And then just a note here that students attending a Maricopa Community College here in Arizona will automatically be directed at that point when they put in the college that they're going to. If it's part of Maricopa, they'll be taken over to Maricopa's student information system to complete the sign up for My Path to ASU. And then if your students are going anywhere else other than Maricopa Community Colleges, then let's look at the next one. They would enter their major. Here it is, sorry. They would enter their major that they're choosing. And these are drop downs, so students don't have to guess on the exact name and all of that. The locations narrow down for them to make it easy, and when they plan to come to ASU. And then they enter some basic biographical information so we know who they are and what they're signing up for. Oh, and yes, I just saw the question. Yes, you can all have the recording and the slideshow sent to you. We'll make sure to follow up with that. Thanks for asking, so everybody knows. So students sign off on acknowledging FERPA allows our institutions to share academic information on their behalf, that they're signing up for My Path, and that we know that they're headed in this direction, or they're at least considering it coming to ASU, so that they can receive those benefits and they can have a smooth transfer. And then at that point, they're prompted to set up a password, and they can go into what's called My Transfer Guide. And they can always go back to TCG, that stands for Transfer Credit Guide, but it is the transfer guide. They can go there anytime to see their transfer guide, but when they go into My Path to ASU from then on, because they signed up, it's going to say My Transfer Guide. Now, if they do change their major, they would just sign up for a different pathway, and then then that would prompt them to set up a different transfer guide. So it's very nice and easy. It's a clear pathway, but it also has those added benefits of the communication and connection to help them have that smooth transfer. And then they would sign in. Go ahead and click one more time, Brenna. On the side that said I registered without an ASU account, unless they've ever attended ASU before. And that would get them into their transfer guide. Thanks. And here's what My Transfer Guide looks like. Very similar, a little bit more interactive. All right, so here's a close-up of what we just saw. I just wanted to point out the tabs at the top. The course search tab is where they can look up any courses that they took anywhere other than your institution, because your institution's courses are going to be down that middle column. So that'll be right there for them. But if they went somewhere else, they can look up those courses in the course search and see how they might apply to the program. And then we're on the My Path to ASU tab currently. The exam search is going to show them the amount of credit that they would receive for certain exam scores on CLEP, IB, AP, and other standardized tests. And then student resources is kind of a potpourri tab with some frequently asked questions and other varying resources from time to time for students. So that's My Path to ASU in a nutshell. And we're going to open it up now for Q&A about the Edson College. So I turn it back to Brenna and Deanna. And then if you do have any questions about My Path, I'm happy to help with those too.
Absolutely. So there is a question in the Q&A right now. So we'll answer this one live. So can a student apply to ASU for nursing with only the AA and community health degree? I thought I saw that on a slide. So that's a really great question. So based off your question, Roxy, I'm assuming that you guys have an AA in community health maybe at your institution. And so they can certainly apply to the nursing program as a transfer student with an associate's degree in community health or just any associate's degree, when they apply to nursing at ASU, they're going to be automatically admitted to our community health bachelor's degree. And so through that program, if they're missing any prerequisites for our nursing program, then we would have them take those prerequisites either with us or at an institution of their choice. And then once they finish or are in progress of finishing their lacked prerequisites for nursing, then we would help them apply for what we call advancement into the clinical program. And so yes, they can come in with just the AA, but they might be missing prereqs depending on what that curriculum looks like. So our prerequisites for the clinical nursing program for a student who doesn't have a bachelor's degree yet, we're going to be looking for their general studies like English 101 and 102, math, statistics, and then we're also going to look for their sciences. So we're looking for anatomy and physiology 1 and 2. We're looking for chemistry, microbiology. There's some healthcare courses, nutrition. So there's quite a few prereqs that we'll look for. But yeah, certainly they could apply and then we can help them kind of navigate what their timeline is to start the clinical nursing program. So I answered your question from the lens of our pre-licensure programs. If a student has an AA in community health and is looking at our online nursing programs, they wouldn't be eligible. They would have to have an associate's degree in nursing or be in an associate's degree in nursing program to do the RN to BSN or CEP. So I just want to make sure I address that too. Hopefully that answers your question, but if it doesn't, please pop more questions into the chat or the Q&A. We'll answer those. And then I'm going to drop my direct contact information also, my email address in the chat. So if you have any questions, you can always reach out. I'm hoping to send some follow-up along with this slide deck out to all of you afterwards, but if you're just so excited to reach out to me, there's my email address. I would love to hear from you. And then Kathy just dropped her email address in there too. So if you have my path to ASU questions or transfer, I'm assuming transfer partnership questions, those types of things, Kathy can assist with those too. And if you're not sure who to email, just email both of us or one of us and we'll work together to connect the right person. All right, so the next question that came into the chat says, hello, since the application process is very competitive and not all students that apply will get into the nursing program, what is the recommendation for students that already have an ADN? What's your advice? Great question. So I didn't mention this and I should clarify. If a student has an associate's degree in nursing and they are a licensed nurse, then they would do the RN to BSN program, right? Because they already have their licensure. They don't need a pre-licensure program. They just want to round out their BSN. That program is not competitive. So if a student meets the requirements for that program, they will be admitted. We will have space for them. That one's the fully online program. The other thing that I didn't add into the slide deck, but I didn't want to get too crazy, but I do want to plug it, is we also have an RN, an associate's degree in nursing, to MS nursing pathway. So if you have a student who wants to bypass the BSN completely, we do have an RN to MS nursing program. That includes all of the baccalaureate and master's nursing essentials per all of the nursing professional organizations. So if you have someone who's really career driven, really focused on maybe leadership roles in nursing or nursing education, they could jump right from their associate's degree to the RN to MS nursing or nursing education. That's also not competitive. If a student qualifies for that program, they will be admitted. And so hopefully that answers your question. The accelerated, traditional, and master's programs we talked about, the master's entry into nursing we talked about on the slides, those pre-licensure programs, those ones are competitive because we have limited space for clinicals, and you probably all have the same issues that you're in your states too. We would still encourage students to apply if they want to do a pre-licensure program with ASU. We have had some cohorts that have been very competitive, and we've had others where we have seats available for the students, all the students who are eligible. So definitely don't let a student write themselves off. We would be happy to work with them on their next best options. Okay, hopefully that answers your question. Okay, so for the TEAS test, when is it needed? Does ASU only look at the first attempt? Great question. So if a student is interested in the traditional, accelerated, or master's entry program, those are the three that require the TEAS, those pre-licensure programs. The TEAS is only good for 1 year, so it expires after a year. And so we wouldn't want them to take it too early. We usually have students take the exam like a couple of months before they're getting ready to apply for advancement. And we have 2 kind of application cycles per year, depending on which program we're talking about. So in those really specific cases, please feel free to send the students to us and we can look at what their plans are when they're ready to advance into the program and we can give them guidance. We will allow students to retake the TEAS if they don't pass it, but they need to wait 30 days from their first attempt. And that's only if they don't pass. And a passing score on the TEAS is 58.7 or higher. So if they earned less than that, they can wait 30 days, retake it, and we'll take their next attempt. If they passed it and they want to try again, we ask them to wait till what we call the next application cycle. And we would really want to work with them through that timeline. So there's no assumptions that lead them to the wrong place. So you can always refer students directly to us and through those links that we provide in the presentation. But those are really good questions.
Deanna, I know you were going to answer a couple questions too, but I started to answer a question. Somebody asked about contact information. So I put the link for ASU transfer admissions in there, but for Edson, who would you like to list as a primary contact?
Yeah, I guess my question would be like, where are the college resource guides? Like, who's the audience? Is it for students? If it's for students, we actually have a team of people. Deanna and I work on the same team, and there's a few of us on that team that respond to inquiries. So we have like a kind of a centralized inbox. So I can pop in that inbox email address. It's just edsoncollege@asu.edu. And then our phone number is going to be listed there too. That comes right into our recruitment and student services team. So that would be the best one if it's a student facing document. If it is like an internal document facing towards just like advisors or other community college staff, then you can list me or Deanna, and we will be able to help whoever reaches out to us. I want to call out this question too. There was a question about the RN to MSN. I know I didn't have that in the slides, but I mentioned it. So I appreciate this question. The question is if it requires that the student has a BA or a BS. So the RN to MS nursing is a true, I guess you could call it like a leapfrog. Associate's degree to master's, there's no bachelor's degree required or in between. I know there are some RN to MS that require a bachelor's in a different discipline, but that's not ours. It's truly a RN to MS program.
There's another question from Kansas. It says, it is for EAC students only on our website, or I guess that's not really a question, but
my thoughts, so I'm trying to, Candace, where you're kind of looking for that. So the EAC cohort that we have is our only like immersion BSN that has a My Path to ASU. That's our ASU at the Gila Valley location. The My Path to ASU options for nursing are primarily online. So that's the RN to BSN and the concurrent enrollment program. Our health programs, all of them should be on there for all of the locations they're offered at. But nursing, like the traditional nursing program, the on-campus nursing programs that are pre-licensure are not affiliated with My Path, because My Path helps to guarantee admission. And we can't guarantee admission because it's a competitive process. So what you're seeing for EAC is actually still the RN to BSN and CEP options. We just have a special partnership with them. Oh, I was referring to what I wanted to name. Sorry, you're like, please stop. Going on too long. Okay, so for EAC students, for the contact information, actually, if you want to list Deanna, do you want to pop your like ASU Deanna Castellanos, and she can serve as the contact. We're working on updating kind of assignments on our side, so that's perfect. Thank you for clarifying. Okay, so another question to clarify, does the 2.5 GPA requirement for RN to BSN only apply to English 101, 102, and math individually, or is an average of those 3 courses, or is it an overall? Great question. The first thing that we're gonna look at for an RN to BSN applicant, other than like, are they licensed and in good standing, is just the English 101, 102, and math. We're gonna calculate the GPA for those 3 courses, and we're looking for a 2.5 or higher. 2.5 or higher. If a student doesn't have a 2.5 in those courses, but say they did really well in their traditional, like what's considered like a traditional nursing prerequisite, like anatomy or pathophysiology or something like that, then we may be able to look at options to help increase the GPA through that. But our first review is looking at the cumulative GPA for 101, 102, and math. That's kind of our first review. And then if we need to work with a student from there, we will. That's a good question. Any other questions? Yeah, you're welcome. Yeah, thanks for all your great questions. I love that. Keeping my mind fresh. Oh, I think when she messaged, Deanna, can you resend it? I think it went to the host, just the host.
Okay, yeah, I will type it again.
Yeah, we're gonna re-add that to the chat. Candace, thanks for calling that out.
Oh yeah, mine too.
I know the Zoom defaults us to only talk to each other and not to the the
That's not very helpful, is it?
It's hard, yeah.
Thanks for calling that to our attention.
Yeah. So for the RN to MSN, does the student earn a BSN before they earn the MS nursing? Great question. In the RN to MS at ASU, there's no BSN degree awarded, so they would only be awarded their MS nursing or MS nursing education, depending on which track they chose. The way the program works is we've historically had the MS nursing programs for years and years and years. And then I think last year was our first cohort that we took for RN to MS. It's the same MS nursing curriculum that the other BSN to MS students take, but they have one extra semester that they take at the front end of their program. It's 2 classes. They are, I think, 3 credit hours each. It might be 4, but I think they're 3 credit hours each. And they essentially are like a crash course on all of the BSN concepts that are critical for nurses to know. So all of those baccalaureate health essentials. And then once they finish those 2 courses, then they join the rest of the MS nursing cohort. So they take 6 additional credits on top of the MS nursing curriculum, but they bypass that BSN entirely. So normally they'd have 45 credits or so, 36 to 45 credits of a BSN to do with us. They skip that entirely and they just do 36 credits of the MS nursing.
Oops, I'm muted. I think we're going to go ahead and wrap it up because we're at time, and we really thank you all so much for coming, and thank you Brenna and Deanna too for being part of this College Connection session. And everybody else, you'll receive information by email from us about future College Connections webinars. Thanks again.
Thank you so much for joining us. It was great chatting with you all. Thanks for your questions.